Welcome to my presentation. My name is Manuel Alejandro Tapia Rukerke and my theme is patellar fracture with sleeve avulsion. Definition: the patellar plays an important role as part of the extension mechanism of the knee, in addition to protecting this joint from direct trauma. Fracture of the patellar is a traumatic descent frequently observed in the emergency department. Their value is very varied depending on the intensity of the trauma. Diagnosis: it is necessary to specify the antecedents of direct or indirect trauma. The patient comes to the work body, referring to pain and inability to walk. On inspection, inflammation, limitation of the joint movement, escoration, or walls were observed. Abnormal mobility, crepation, was palpated. Palpating the separation growth between the displaced fragments. During the physical examination, it should be remembered to show the patient to performing activity extension of the lead, since if there is no rupture of the extensor mechanism.
Patellar fractures. Basic anatomy. You can see the femur, the tibia, the fibula, and the patella, which we call it the kneecap. The kneecap is attached to the quadriceps tendon at the top and to the patellar tendon at the bottom. Movement of the patella across the knee is normally a gliding, smooth movement. A patellar fracture is an injury to the kneecap. These fractures are commonly caused by a direct blow to the kneecap or from a fall. Patellar fracture types. Transverse fracture. The fracture can be non-displaced or displaced. This is an example of a non-displaced fracture. Displaced fracture. The patella can be pulled apart by the attached thigh muscles. The patient will be unable to do active extension of the knee. Upper or lower pole fracture. The fracture at the site of the attachment of the patellar tendon, as you can see here. Comminuted fracture means multiple pieces. The fracture can be non-displaced or displaced. This fracture type shatters into 3 or more pieces and is very unstable and hard to treat. Vertical fracture. The fracture is non-displaced and stable. The fracture fragment usually stay in place during healing. Osteochondral fracture. A small fracture of the patella, usually associated with acute dislocation of the patella. The osteochondral fractures are usually located in the facet area of the patella. Treatment. Example of a transverse patellar fracture. If the fracture is non-displaced or minimally displaced, and the patient is able to do full active extension of the knee, the patient is usually treated by a knee immobilizer or a brace. Transverse displaced fracture. The patient is unable to do active knee extension. Usually, this displaced fracture is treated by surgery. You can see here reduction of the fracture with a reduction clamp. K wires are placed perpendicular to the fracture. Figure 8 tension band wire is applied for compression of the fracture. These tension band wires convert the anterior distractive forces to compressive forces at the articular surface. As the knee moves in flexion, there will be compression at the articular surface. The other technique is cannulated lag screw with tension band. The wire passes through screws and crosses the patella in a figure 8 tension band. Partial patellectomy. It usually involves the distal pole Smaller fragments are usually excised. The patellar tendon is reattached anteriorly with sutures. Total patellectomy is usually indicated for comminuted and displaced fractures of the patella that cannot be reconstructed. The bony fragments are excised before the reattachment of the patellar tendon. All my videos and this video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.
Retainment. Retainment of this design may be the conservative or surgical. Once the patient goes to the emergency rooms with this condition, a series of the important measures must be taken in order to reduce the pain. The first action of the patient is the aspiration of the intra-articular blood, application of ice and analgesic. Later, immobilize the limb until determining the definitive treatment. Complications. The most frequent immediate complications are those in which soft tissue adjacent to the fracture, including infection, are infected. They are anatomically conditional by the subcutaneous location of the patellar, so it is necessary to perform a thorough surgical technique and the use of the prophylactic antibiotic therapy. Conclusion. The patellar fracture is the traumatic design found more frequently than reported by some actors. Its diagnosis is evident by the anatomical situation of the patellar and dysfunction. The conservative treatment has its specific indication according to the clinical and radiological criteria mentioned above. Surgical treatment also a key incorporation of the patient into the rehabilitation process and restoring the joint surface and incorporate the patient into his social life as soon as possible. The complications of the design are closely related to the anatomical situation of the patellar and the treatment variabilities.
In today's video, we want to briefly go over patellar fractures. These are fractures of the patella or the kneecap, and they can run the gamut from severe to mild. Patellar fractures account for about 1% of all fractures. They happen mostly to individuals between 20 and 50 years of age, and men are twice as likely to have a patellar fracture as women. It usually is due to a severe blow to the kneecap, automobile accident, falling, things of this nature, although severe muscle spasms can also lead to these types of fractures. So we want to go over briefly just some of the ways that it can happen. There can be a vertical form of the fracture, as we have here, a transverse form of the fracture, as we have here, or a comminuted form of the fracture, which means it's broken into 3 or more pieces. So you've got a vertical up and down, transverse going across, and comminuted, meaning it's 3 or more pieces. Once you know what type of fracture it is, then you need to see how severe it is. A stable patellar fracture is one where it has not separated and the pieces are still touching each other and lined up. A displaced patellar fracture is one where the pieces are separated from each other and no longer lined up. With a stable patellar fracture, you usually just immobilize the joint through a cast or a splint, some sort of immobilizing knee joint that keeps any sort of flexion from happening at all. So the joint is completely immobilized and no weight can be placed on that knee or that joint for 6 to 8 weeks, basically, allowing the fracture to heal. And then that's usually followed by rehab to re-strengthen the muscles and also to regain range of motion in the joint. So stable ones are the easiest to treat. These are the ones where the fracture is not displaced. They remain together, and therefore it can be immobilized, no weight bearing, and rehab. Now displaced ones where there's separation in the bone and the sides do not meet, this usually requires some form of surgery. And of course, if you've got a comminuted with 3 or more pieces, it absolutely requires surgery to get that to heal properly. When they do this surgery, if they're able to do it and they don't have to remove any of the bone, as might be possible in a comminuted fracture, they usually create something like this. They use pins and tacks to take a tension line and run it in like a figure 8 over the kneecap, pinning it to the bones in the area, just to hold everything together and still. And then that is immobilized while it all heals. But you've got to keep tension on the area, because basically if you don't tie everything together, then when the quadricep flex, you pull the pieces apart again. So you pin it, put tension on it in this figure 8, which holds it all together while it heals. So the displaced form, where it comes apart, comminuted, you usually need surgery. Once again, immobilized, no weight bearing, and then the rehab follows. So it can be a very painful fracture to have. It's not that common, only 1% of fractures, and as we said, men twice as likely as women for whatever reason. But it's a very painful fracture, and one that can inconvenience you a great deal, given the fact that you're not able to use your knee and put any weight on your leg for 6 to 8 weeks, even if it's a stable one and not displaced. So a lot to take in there. This has just been a basic overview then of patellar fractures, what they are, treatment, things like this. If you'd like to learn more about this or related matters, underneath this video you'll see a link. If you'll click on that link, it'll take you to the website that has that information. And while you're on that website, you'll also see a link to an